For the Senior Friendly Hospitals Action Program, the Specialized Geriatric Services Ambulatory Team at St. Joseph's Healthcare London had a desire to enhance the patient experience within their ambulatory area. When reviewing the literature for best practices related to Senior Friendly, the team quickly discovered any comprehensive environmental audit available was largely intended for the inpatient physical health setting. Identifying this gap, the team began to compile best practices for ambulatory settings. Out of this work, the Senior Friendly Hospital Toolkit for ambulatory settings was developed. The toolkit has been developed as an Excel workbook divided among tabs.
The toolkit has been set up to be followed along like chapters in a book, accessing the tabs from left to right. The Groundwork tab outlines how to assemble your team and select the ambulatory area to focus on. The next tab, Self-Evaluation, is to be used to evaluate your area based on current best practice with the opportunity to add notes as you go. Depending on the size of the area, it may take 2 to 4 hours to complete the self-evaluation and can be broken up into sections to make it more manageable. Based on the information inputted, the Senior Friendly Hospital score will automatically populate at the bottom of the score sheet. Once you have completed the self-evaluation, it is time to prioritize which best practices you and your team will address first. The next tab, the Prioritization Grid, will help guide you through this process. As a team, you will determine the potential, importance, and ease of achieving each unmet best practice on a 1 to 3 scale. Once finished, the items with the lowest total are the items most easily achieved with the greatest potential and most importance to the patient population. With any quality improvement work, it is important that the voice of the patient is integrated in the process. The Patient Voice tab provides resources for conducting a focus group with your patients, including a checklist and templates for the invitation, consent form, and thank you letter. Other methods to hear from your patient population are referenced in the Additional Resources tab. The remaining tabs in this toolkit will guide you in how to develop a work plan, carry out your work, and provide you with additional resources.
Once building this toolkit, the team used it to guide the work in the Specialized Geriatric Services ambulatory area. The team assessed their environment using the self-evaluation and met to review the results and determine the potential, importance, and ease of each unmet best practice. The prioritization grid helped to identify quick wins, and the team immediately set out to address some of these, such as the installation of senior-friendly clocks and the implementation of a communication toolbox, and worked to engage necessary stakeholders to address the more complex changes such as wayfinding and standardizing patient letters. In an effort to reduce falls and responsive behaviors, the Geriatric Inpatient Psychiatry team adapted this toolkit for their unique setting to identify barriers, prioritize opportunities, and have implemented a number of changes such as signage, increasing door delays, and implementation of calendars in patient rooms. We thank the Senior Friendly Hospital Action Program for supporting us and building our capacity to tackle these projects. Thank you to the Specialized Geriatric Services ambulatory area and Geriatric Inpatient Psychiatry team members for their vision, commitment, and passion for enhancing the patient experience. For a copy of the toolkit, or if you have any questions, please feel free to contact Kim Kerr, Suki Brar, or Lindsay Butler.